Today we will talk about some other pulmonary conditions. As described on this slide, tracheomalacia is a structural abnormality of the tracheal cartilage allowing collapse of its walls and airway obstruction. Pneumonia is an infection in our lungs and where the air sacs fill with fluids which may prevent oxygen from reaching your blood. The American Lung Association has nice references to many types of lung conditions, one of those being pneumonia. Pneumonia may be caused by bacteria, viruses, mycoplasmas, other infectious agents such as fungi, or various chemicals. One may have lobar pneumonia, where it affects a certain section or lobe of your lung, or bronchial pneumonia, which affects areas throughout both of your lungs. Symptoms of pneumonia may include flu-like symptoms, fever, headache, muscle pain and weakness, chest pain, chills with shaking, cough, excessive sweating, rapid heartbeat, difficulty breathing, or sore throat. High blood pressure in the arteries that supply the lungs is called pulmonary hypertension. This disease causes the walls of the arteries of the lungs to tighten and stiffen. Screening for pulmonary hypertension may include a chest x-ray, pulmonary function test, an echocardiogram or an ultrasound of the heart. If these point to pulmonary hypertension, your physician will schedule a right heart catheterization. A cardiac catheterization measures the pulmonary artery and heart pressures. In many cases, there may be no cause that can be identified as to the reason for pulmonary hypertension. In these situations, it is referred to as idiopathic or primary pulmonary hypertension. Pulmonary hypertension may be caused by another medical condition, often referred to as secondary or associated pulmonary hypertension. Pulmonary hypertension may be linked to certain drugs and/or toxins. Inherited gene changes. Genetic testing is available to learn if you carry the PH gene. Secondary pulmonary hypertension is a situation where pulmonary hypertension results directly from another medical problem. Medical conditions that may lead to secondary pulmonary hypertension include blood clots in the lungs, COPD or other chronic lung diseases, connective tissue disorders such as scleroderma, hypoxia, sleep apnea, congenital heart disease, and HIV/AIDS. This slide shows how the disease affects oxygen pickup in the lungs. In the normal category, you see the alveoli having much contact with the capillary bed where the red blood cells are in. With emphysema, you see the alveoli in a different shape and thus having limited contact with that capillary bed, not allowing a lot of oxygen to be transfused through there. With anemia, you show low amounts of red blood cells circulating through the capillary bed, and thus there's not the ability for oxygen to be picked up. pulmonary emboli, you will see a blood clot which impedes the ability of the red blood cell to get through to the area where the oxygen can be dropped off from the alveoli. Pulmonary fibrosis shows you a thickening of the alveoli, thus making it much harder for that oxygen molecule to get through that stiff thickness of that alveoli down to the red blood cell to be carried. Here you have the opportunity to take the knowledge quiz to review the information that we shared with you in these slides. The answers to the quiz are on the second slide.